When the Island Health Overdose Prevention Site in Nanaimo opened at 11:15 this morning, there was a lineup of people waiting to go in. Among them is Jason Mabug, who says he usually uses at the OPS and says not having it could have dire consequences.
I think the streets should be lined with dead people.
Should there be more overdose prevention sites?
Yes, and the government should be giving out fentanyl to people.
Safe supply of drugs?
Yeah, the drugs that we're addicted to, not some other mimic copy drug that doesn't work.
Nanaimo is home to one of 8 overdose prevention sites across Vancouver Island that saw more than 18,000 visits in the past 4 years. 6 of the sites offer inhalation. The Health Authority's inhalation site in Victoria just opened this past December. The issue is front and center in the BC election race after BC Conservative leader John Rustad says he wants to eliminate all of the overdose prevention sites in the province and replace them with mental health and addictions treatment centers instead.
This idea of these inhalation sites, they're not safe. These injection sites as well. Enough of the drug dens. We need to be converting them over to make sure they're connected with recovery. There may be some that we need to keep open over the short term.
In a statement, a Nanaimo Public Safety Group says while the sites don't necessarily need to be eliminated, the impacts they have on the surrounding neighborhood needs to be appropriately mitigated and that law enforcement needs to be equipped to deal with the influx of organized and street-level trafficking and violence. Adding that if an OPS can't be operated without inducing and concentrating street disorder, then it shouldn't be allowed to operate. The Nanaimo area network of drug users says overdose prevention sites aren't just a place where you can use safely, but also a place where you can find help when you're ready.
We have a model for injection sites and safe consumption sites, and it's Insight. And upstairs at Insight, there's a detox. And I don't think most British Columbians are aware of that. So you can go there every day and ask to see if you can get in. And in the meantime, you're safe using the drugs in the injection site while you develop relationships.
BC's provincial health officer and previous chief coroner have both said overdose prevention sites are key to saving lives, but the Conservatives, if elected, plan to chart their own course in the face of the ongoing overdose public health emergency.